Chart review, case 3. Here we responding to 68-year-old male laying supine on the floor in a hotel. It looks like some kind of exercise workout room. There's a family member there and some police and fire guys. Patient unresponsive with agonal respirations, but has a pulse at the carotid and radial. No active bleeding or obvious signs of trauma. I'd like to know whether the person is, cyanotic, any type of posturing or anything in the airway. But we'll move on. So, a patient witnessed by the wife to have this cardiac arrest or actually pass out, syncopal, and the wife states is a healthy individual, had no complaints prior today. Reports that they were working out, running on the treadmill for about 20 minutes, and the wife says she had stopped her run and grabbed tissue for her husband. Not exactly sure why he needed that. I don't know if he's sweating. When she returned and handed him the tissue, she noted that the tissue fell to the floor and witnessed the patient began to collapse or pass out. Wife reports that she was able to catch and brace him to the floor. The bystander's sister again into lowering him to the floor, and they initiated CPR. And the hotel staff grabbed the AED. Patient was shocked 3 times prior to the EMS arrival. So fire reports that upon their arrival, patient had a strong pulse with agonal respirations, and the wife stated that had not been to a physician office in years, and as far as she knows, has no medical conditions, health problems, and takes no medications and no drug allergies. There's some denials here. I'm not exactly sure what he complained of prior. That would have been better to put down our pertinent positive. And this is okay, but it's just a stamp again. Here's on our exam. Of course, he's a GCS of 3. We're looking at this area. It doesn't say any kind of cyanosis to the face, but we'd like to paint what he looked like at that time. Lung sounds are clear. Now they're providing some type of ventilatory support with bag valve mask, high flow oxygen. He did take the OPA. Continued bag valve mask. They're able to intubate this patient, and then they secured it 22 centimeters at the lip, and it's moving. Here you got end tidal 38 to 40 lung sounds are positive and no epigastric sounds on auscultation. Let's see. They also started an IV 18 gauge in the left forearm. And they gave some etomidate and succinylcholine. So I'm not exactly sure if in post arrest, when agonal respirations and they're assisting, and this person also had an OPA in, whether or not the need for PADI protocol or paralytic assisted intubation with these drugs were required, if they could have instrumented uh, without it because the person had no gag. And we can take a look here at the patient. They said 68. They're not giving us a weight anywhere in there, so we're not exactly sure whether they got this. So they went with 30 milligrams of etomidate. I believe that's 6 cc's. And then they went with 150 7.5 cc's. I'm I'm not sure if this dosage is right. 0.3 milligrams per kilogram. So these are off. They continued to transport patients placed supine. Let's see. They maintain the ventilation rate here and transported to the hospital. This is a status post cardiac arrest or cardiopulmonary arrest. We'd like to know what was going on. If they had 12 lead in place, that would be nice to see whether or not the person was suffering from some kind of sudden cardiac death in response to the arrhythmia, such as ventricular fibrillation or ventricular tachycardia. We need to start thinking about the H's and T's as far as what might have caused this kind of cardiac arrest and post-arrhythmic type states. We might give an antiarrhythmic as a drip, lidocaine, amio, procainamide to ensure the person doesn't come back into this. However, we're not really sure the real cause of this. Let's just make sure that as we go through these type of chart reviews that we paint a chronological picture. We're able to answer the questions about the prior complaints and history. It's showing none, so not sure how the health status of this patient was. I mean, does he look like he's a very healthy individual or not? Wasn't painted in the picture. And then what they did prior and post. Um, They did again give some jugs to make sure that when we give the jugs that the jugs are correct. Um, did they connect them up to end tidal here? This is reading. This is reading good. Being that the person was in cardiac arrest and had this anaerobic metabolism, not sure if 12 is okay because it's on the higher end. 20 is kind of high, but that's probably the reason why we start blowing this stuff off, which is good. We're getting it down into the normal rates. That's what we want to try. And definitely hooked up to 100% oxygen, the blood gas is going to read pretty high as far as oxygenation goes. But I wonder what his blood gas would be. 7.35 when we'd see some type of compensation where we have a respiratory compensated. So it's partially or it's compensated here because it would be 7.35, and then your bicarbonate would be low because he was acidotic for some time, but because they're hyperventilating the patient, we're able to off gas, so it'd be compensated by the respiratory system. All right, not a bad start on these charts, but we definitely want to tighten these up.